Well, many thanks for still watching with us right here. Breakfast Central on News Central. It's now time to get the latest when it comes to COVID-19, Omicron, COVID-19 variants. Well, we've been battling it quite long, haven't we? Well, here to return to give us all of that is Joe Hansen. Joe, morning to you. Long time no see. Now, let's talk about vaccinations this time, and starting in Kenya.
Thanks, guys. Good morning to you, Lisa. Good morning to you, Oluchi. Well, the number of fully vaccinated people in Kenya has actually risen to over 19,040 as the country continues its nationwide COVID-19 inoculation drive. With the increase, the total number of complete vaccinations stands at over 3.57 million from a total of over 8.86 million vaccine doses administered so far. Kenya's mass vaccination drive is currently on its 10th month, having been launched in March. The drive initially targeted persons considered to be among high-risk groups. We're talking about the older people, including the elderly, persons with underlying health conditions, and essential workers, including healthcare staff and security personnel. So kudos to Kenya. They are actually trying and they're doing well. But don't forget as well that there was a court order that was not accepted by many Kenyans. It was indeed the governor who, the president, I beg your pardon, who came out to say that going forward, if you do not have your vaccine certificate or you do not have anything to show that you have been vaccinated, you will be denied access to public spaces like hospitals, malls, bars, restaurants. And a lot of people didn't find this to be very interesting. So a high court in Kenya actually suspended that, and they got an order to say, no, this will not work. So Lisa, Kenya is actually doing all possible to ensure that everyone is vaccinated. But let me take you guys straight away from Kenya. Let's go to South Africa now. And let me tell you this. Well, as the Omicron variant continues spreading across South Africa, the country's mineral resources and energy minister, Gwede Mantashe, has tested positive for COVID-19. According to a statement, Mantashe tested positive on Saturday after experiencing mild symptoms. Now, this is the second time the minister tests positive for COVID-19. Mantashe's positive test came after President Cyril Ramaphosa, who also tested positive after returning from a West African trip, was actually mentioned too. Now, South Africa's National Institute for Communicable Diseases, NICD, says that 16,080 new COVID-19 cases have been identified in South Africa, which brought the total number of laboratory confirmed cases to over 3.2 million. A tough one there in South Africa. So the minister, the second time around, Olisa Oluchi, is not just once, but now he's picking it up the second time. And then you have the president as well, mild symptoms. This shows that no one can actually be safe. We just need to protect ourselves.
All right, Joe. So South African minister picks up COVID-19 too. Well, we just had, Ramaphosa himself going through isolation not too long ago. All right, let's look at the Africa Disease Control Index there, Joe, shall we? Let's have the numbers.
That's right, Lisa. So the index, as you can see on the screen, according to the Africa Center for Disease Control, the region has actually recorded over 9.2 million cases, over 226,000 deaths, and over 8.38 million recoveries. Now, this number, as you well know, spiked due to the fact that there is the Omicron variant, and Africa is actually doing all it can to ensure that citizens are indeed vaccinated. So remember also that a third dose has actually been approved in other countries, like here in Nigeria. We also have that access to take a third dose. So Olisa Oluchi and myself, we might be looking at also going for that third dose, although a few others have actually taken theirs.
All right, and I know the third dose, which is like a booster shot, is to be taken 6 months after you must have completed the first and second dose. In Nigeria here, I know a couple of people who have actually taken their booster shot or the third dose, as it were.
Really?
That's right.
Yes, Olisa, you will take your booster dose, Olisa.
And the haves not.
You're shaking your
That's my case.
Olisa,
all right, thank you very much, Joe, when it comes to the update, when it comes to COVID-19.